This is the fourth video of the nurse training videos. We will be discussing physician's orders, also known as POs, advanced personal care plans, Healthy Blue assessments, and lastly, good nursing practices. This is what physician's orders look like. There should be a copy of it in your nurse training binder. Physician orders, sometimes called POs or doctor's orders. These must be completed at the beginning of nursing services for each client. You will attach a medication list to it if med setups are on the care plan and hand this into the office for them to fax to the doctor. Also, we must have physician orders for every client receiving nursing services, meaning weekly med setups, nail care, APC, or any other service needed by the nurse. The doctor will sign these and send them back to the office. Then the office will place it in the client file. An order must exist for every medication that the nurse places in the planner. Orders must also be completed every 6 months for each client receiving nursing services. Anytime a GHE is completed on a client, a physician order is to be completed at the same time, which is typically every 6 months. Your office will fax all the POs to the doctor's office when you turn them in. The office should let you know when the doctor has signed and returned them to us. Once the signed POs are received by the office, you will then check to make sure no changes were made. Next, we will go over advanced personal care. This form is the Advanced Personal Care Task Sheet. Advanced Personal Care, or APC services, are maintenance services provided to a recipient in the individual's home. This is to assist with activities of daily living, when this assistance requires devices and procedures related to altered body functions. The following activities constitute advanced personal care services and shall be provided according to the plan of care. Routine personal care of clients with ostomies. You will only care for well-healed stomas, which include changing bags and soap and water hygiene around the stoma site. Personal care of clients with external, indwelling, or suprapubic catheters, which include changing bags and soap and water hygiene around the site. Removal of external catheters. You will inspect skin and reapply catheter. Administration of prescribed digestive tract programs, which include the use of suppositories and sphincter stimulation per protocol, and enemas prepackaged only for clients without contraindicating rectal or intestinal conditions. Applying medicated prescription lotions, ointments, or dry aseptic dressing to unbroken skin, including stage 1 decubitus, as well as application of aseptic dressings to superficial skin breaks or abrasions as directed by a licensed nurse. Manual assistance with non-injectable medications is to be set up by a licensed nurse. Passive range of motion, non-resistive flexion of joint within normal range should be delivered in accordance with the care plan. Use of assistive devices for transfers. These are the services which fall underneath APC, which will be listed on the client's care plan. Training of APC aid will be conducted by a RN or LPN. The LPN will first need to be task trained by a RN. Each client who receives any form of APC will have a monthly nursing visit, which can be conducted by a RN or LPN. The purpose of these monthly visits is to evaluate the APC care plan and ensure that it remains effective for the patient, and the nurse is also evaluating the aid's ability to perform the APC tasks. This should be noted on your nursing ticket in the nurse comment section. The nurse will also check under nursing services delivered. Place a checkmark on Evaluate APC Care Plan. If the APC client receives a weekly or monthly nurse visit, this evaluation shall be completed during that visit. APC must also be listed on the physician's orders when the nurse is completing them. Training of an APC aide must be conducted by an RN or LPN, and documentation of training must be provided to the office, so this can be placed in the employee file in Procura. When the nurse is task training an aide, the Form APC Task Training Sheet should be used. The last form we will go over is the Healthy Blue Nurse Assessment. Nurses may be asked to complete the Healthy Blue Nurse Assessment form on a client. This assessment will consist of 4 forms and a nurse visit report. The purpose of this visit is for the nurse to assess and help formulate a care plan based off what the nurse and client or family deem necessary. These forms you will use are called Healthy Blue Nurse Assessment. If you need any guidance with these, your office or I can assist. Nurses should be in tune with the patient care, place calls to doctors, request refills on medications if the patient wants them to, and update medication lists with physician orders as meds change. Be kind and courteous to your clients. Always take your time. I know time is valuable. However, knowing your client, their baseline, and when something is not quite right can mean recognizing early signs of a future problem. I want to thank you for your time, and remember, if you ever have any questions, please reach out to your office or myself.